Hello, how are you? Hope you are fine. Uh, Now, today we are going to discuss an uh, topic on the bovine infectious infertility. We have dealt with the non-specific infections, and today we talk about the bovine infectious infertility. What bacterial, viral, and other infections can cause the infertility in the bovine species, right? So we are going to discuss this in our today's live class, and I hope it will be useful for you. So let us start discussing what are the different causes of bovine infectious infertility, right? Now, the specific causes of infertility and abortion basically include the bacteria, the Brucella, Campylobacter, Leptospira, Listeria, etc. And then the viruses, which include the IBR, IPV, the bovine virus diarrhea, and then the protozoa, especially the Trichomonas and Neospora and Toxoplasma, are also known to cause the infertility in the bovine species, right? Then fungi like Aspergillus can also lead to infertility in the bovine species. So we are going to discuss about the important ones, which ones can cause infertility in dairy cattle, right? Now, first let us discuss what is abortion. Abortion is the loss of fetus from day 42 till day 260 of gestation in cattle. Peters have defined this in the last 10 years back. The loss before day 42 is considered as early embryonic death, and delivery of a fetus after day 260 is considered a premature birth. Right? Then delivery of another definition is delivery of a fetus before completion of gestation, but that fetus delivered which is incapable of independent life. So that is also described as the abortion by some other workers, right? Now there is a term venereal diseases. So we need to talk what are the venereal diseases. The bacteria, viruses, and protozoal organism can cause venereal disease in cattle. And what is venereal disease? A disease that is transmitted by the sexual act, the act of coitus. That is considered a venereal disease. And Campylobacter fetus, Trichomonas fetus, bovine herpes virus, Haemophilus somnus, urea plasma, mycoplasma, and bovine virus diarrhea are the most commonly recognized causes of venereal diseases in cattle. And the most common ones are Campylobacter and Trichomonas. These two are most common venereal disease of cattle or the infectious venereal disease of cattle, right? Then, as I said earlier, venereal diseases are those which are transmitted by the act of coitus, and Trichomonas and Campylobacter infections can cause early embryonic death or first trimester abortions. Young bulls usually clear the organisms quite rapidly, but become reinfected upon breeding with a cow that is carrying an infection. Once the organisms are present in the herd, they can be passed from cow to cow by the herd through the bulls or by transmitted by contaminated breeding equipments. And older bulls, aged 4 to 5 years, are more often chronically infected by these two venereal diseases. Now, first we talk about the trichomonas. Trichomonas, Trichomoniasis is caused by a mobile, complex, three-haired, single uh, celled protozoan called Trichomonas fetus. This organism survives in the microscopic folds of the skin that line the bull's penis and internal sheath. The prevalence is worldwide, and infectious disease causing it is an insidious disease causing sterility, abortion, and pyometra. So, trichomoniasis also causes post-service pyometra. The transmission is from cow to cow by the bull, nearly always a disease of cattle who are naturally bred. Uh, it is transmitted by sexual contact with an infected mate. Rare cases of transmission through artificial insemination have also been reported. Right now, what are the clinical signs in cattle? Repeat breeding, abortion in first half of gestation, post-service pyometra. The cow does not appear ill, uh, but infected during the breeding. The cow may show a subtle, mild vaginal discharge 1 to 3 weeks later, what we call the post-service pyometra. Protozoa attach to the lining of the reproductive tract. An inflammatory response occurs, resulting in the death of the embryo and hence repeat breeding. So, trichomoniasis causes repeat breeding in dairy cattle. The bull is a asymptomatic carrier in which is affected with trichomoniasis. It shows no signs. Semen quality and sexual behavior are not at all affected, and uh, the trichomonas lives in the crypts, folds inside the sheath. Crypts are deeper in the older bulls, so older bulls are more chronically infected. As the bull ages, the skin grows, pores increase in the penis and the sheath, creating additional places for the organisms to grow. Older bulls of about 3 years of age are more likely to be infected, become chronically infected as compared to the younger bulls. Now, the bull becomes a lifetime carrier, and it is best to test after 2 weeks of sexual rest. If you want to test a bull, you have to test it usually after 3 weeks of sexual rest. Sometimes the trichomonads can be observed under the microscope immediately. Usually, but usually a culture is required for 1 to 7 days, and the preputial washings are collected, and the organism culture can be done. Organism can sometimes be visualized in the preputial washings, but you may need to culture for 1 to 7 days. Uh, and even if you find a bull, uh, even if a bull is positive, you mm, is negative, you may have to assume that the herd has been exposed. Cows usually clear infection rapidly and test soon after embryonic death or pyometra. If it cow is developed pyometra, collect the secretions or the fluids that are expelled in a cow infected with pyometra and observe it under a microscope as a wet film. So usually there will be a history of new bull introduction in the herd, and after that bull introduction, the problem appears very uh, prominent. You can make a direct smear abomasal contents of the aborted fetus. Then you can make a wet smear vaginal discharge or preputial washings. Then you can go in for organism culture using diamonds or Toby's media. Transport at 4 degrees centigrade. You can use the vaginal mucus agglutination test, or you can use the virgin heifer test mating. All these tests can be used to test a bull for trichomoniasis. Now, how to control? It is easier to prevent the infection than to try to control it after it enters the herd. Avoid contact of uninfected cattle with other cows and new bulls. For infected cows, give sexual rest for 8 to 12 weeks. Avoid renting or leasing bulls. Replace culled bulls with young bulls. Use AI for breeding and for therapy of infected animals. You can use imidazole derivatives, sodium iodide, and you can use these things for local application in the bulls, and you can get the infection. But a bull, once it is infected, it should be consecutively tested before it becomes free of infection to be used for natural mating again, right? The trichomonas Fetus vaccine Trichgard is available in some countries, and one can use it for vaccinating cattle. Then another insidious disease is Campylobacteriosis. It's caused by Campylobacter fetus, a gram-negative bacteria affecting cattle, buffalo, sheep, and goats. The disease is venereal in cattle and is characterized by early embryonic deaths, increased services per conception, and abortion at 4 to 6 months. Uh, for trichomonads, uh, clinical trichomoniasis have seldom been observed in the buffaloes, and the reason behind these are not known. Although cattle and buffalo reside nearly in the same environment, but buffaloes are considered comparatively resistant as compared to cattle. Now, Campylobacteriosis is a cause of infertility and abortion, and many species are there. Campylobacter jejuni, fetus subspecies venerealis, fetus subspecies fetus. It is the subspecies venerealis which causes the venereal disease. The organism survives in moist environments for weeks to months, and some strains also tolerate extreme cold. They remain viable in feces, milk, water, vaginal discharges, and poultry litter. The clinical signs in Campylobacter are also very not very prominent. Animals may show early embryonic deaths, increased services per conception. Abortions are uncommon but can occur due to Campylobacter fetus infection. The male is a asymptomatic carrier both for Trichomonas and the Campylobacter. The males are asymptomatic carriers. Adult bulls are more affected and may carry infection for long times. Sheep aborting 1 year are resistant the next year. Right? The diagnosis of bovine genital Campylobacteriosis, you need to take the history of increased services per conception, repeat breeding, and organism identification in samples is difficult, and you need Clark's or Diamond's media for sending the samples to the laboratory. You can use the vaginal mucus agglutination test, virgin heifer test mating, fluorescent antibody test, detection of IgA in cervical mucus, ELISA culture, sheep washings, vaginal cultures. All these can be used for definitive diagnosis of Campylobacteriosis. And bulls may be treated, but cows are usually not treated. Uh, at all places where AI is the only means of breeding, the disease has disappeared. Why? Because antibiotics are added to the semen, and the Campylobacter, being a bacteria, is killed by the antibiotics streptomycin, penicillin that are being added to the semen diluters. Then again, a vaccine is available, but you should avoid renting or leasing bulls, replace culled bulls with young bulls, and test all new bulls. Right? Disinfection: Campylobacter species is susceptible to 1% sodium hypochlorite, 70% ethanol, 2% glutaraldehyde, iodine based disinfectants, phenolic disinfectants, formaldehyde, moist or dry heat, gamma irradiation, and UV radiation. Right? Then we discuss another important disease, which is also of zoonotic significance, that is Brucellosis, also known by the name Andulant fever, contagious abortion, Banks disease, a zoonotic bacterial disease affecting cattle, buffalo, goat, sheep, horses, and dogs, and causing late gestation abortions in cattle, and orchitis in bulls, often seen in the form of outbreaks. A lot of abortions occur in a herd. The organism Brucella organism is a Brucella abortus gram-negative Coccobacillus. It is a facultative intracellular pathogen having 9 biovars. Additional brucellae that affect cattle include Brucella melitensis and Brucella suis. It can persist in the environment, and uh, control of brucellosis requires very specific measures. The populations at risk, maybe cattle ranchers, they can even human beings can get the disease, and these are the populations which are at high risk of contracting brucellosis. Cattle ranchers, dairy farmers, veterinarians. So it's a word of caution for every veterinarian. If there is a case of 7 to 8 months abortion in cattle, you must presume that it may likely be Brucella abortus. So don't remove the placenta of such animals with your bare hands, because you can contract the disease. And you always be careful with such animals, uh, and avoid direct contact with the placenta or fetal membranes or fetuses. Do not touch them, because you can just contract the disease. Then consumption of unpasteurized dairy products can also lead to development of the undulant fever, or sometimes human beings can contract multiple arthritis like symptoms. The disease has a worldwide distribution. Some countries have eradicated it, and it is a notifiable disease in many countries. The World Health Organization for Animal Health reports that poor surveillance and reporting due to lack of recognition has led to a wider dissemination. The mode of infection of this disease is ingestion of contaminated pasture, water, licking aborted fetuses. Organisms are shed in milk and uterine discharges. The uterus of pregnant cows gets infected by blood, and the erythritol sugar in the uterus is a good medium for the growth of the brucella. So, the brucella multiplies very fast because of presence of erythritol and causes placentitis and fetal toxemia, and ultimately the death of the fetus. After abortion and uterine involution, organisms colonize in the udder. So be careful. The organisms can colonize in the udder, and they may appear in the milk as well. In cattle, the clinical signs will be abortion, stillbirth, birth of weak calves, retained placenta, decreased lactation, and in bulls may develop epididymitis, orchitis, and even human beings can develop undulant fever, polyarthritis, even brucellar keratoconjunctivitis leading to blindness. So veterinarians should be very cautious about brucellosis. They should they should avoid the direct contact with infected material or everything. Now, the laboratory diagnosis depends on direct examination, serology, Brucella antigen test, complement fixation test, ELISA, and others. Then, milk testing, culture and identification, and PCR can be used. Then, stain smears from aborted material using the Koster and Gill Nelson method, the organism can be identified. Organisms can be cultured from fetal stomach, placenta, which is a placenta has a Moroccan leather appearance because of severe placentitis. The placenta of aborted fetuses have a Moroccan leather-like appearance. Then there are the serological tests, the Rose Bengal test, the CFT, the FAT, the MRT. One can use any of these tests for diagnosis of brucellosis. The Rose Bengal plate test can be used as an initial screening test for serum samples. All positive samples are re-examined using the serum agglutination test or CFT. Rose Bengal negative samples are not normally tested. A serum agglutination test is very widely used, but detects non-specific antibodies as well as specific antibodies from Brucella infection and vaccination. The CFT is more definitive test than the SAT, especially in differentiating titers arising from infection or from vaccination. The MRT, which detects Brucella antibodies in milk, is very useful in herds by collecting bulk mix samples or in individual animals. Positive results can then be followed up by using other diagnostic tests on individual animals. The post-mortem lesions include granulomatous inflammatory lesions, reproductive tract, udder, lymph node, joints, abnormal Moroccan leather type appearance of the placenta, enlarged liver, and in the bulls there may be a swollen scrotum and this orchitis. These are the findings in the bulls. For control of brucellosis, there is a strain 19 vaccine, which is also known as the calf hood vaccine, done at 4 to 8 months. But male calves should not be vaccinated with this vaccine because it can interfere with the diagnosis later on. Only the female calves should be uh, vaccinated with the strain 19 vaccine. RB51 is a newer vaccine which can even be used in adult cattle, and the control usually involves notification, isolation of aborting animals, disposing of aborted fetuses, placenta. So they are very important. And then even it is advocated not to, because brucellosis can occur in other species as well. So avoid contact of of your healthy animals with these types of animals. Then the next disease is genital mycoplasmosis, ureaplasmosis. They are cell wall deficient organisms. Mycoplasma causes vulvovaginitis, and both these organisms can cause infertility and abortion. They are frequently isolated from semen, and their transmission is through semen. So, mycoplasma is becoming increasingly important as a disease uh, causing abortion and infertility. Then, genital tuberculosis. It can be peritoneal with adhesions of the uterus, multiple abscesses in the abdominal organ. It can be glandular, nodules formed in the uterus, and it can be epithelial, pin sized granular lesions observed at multiple places. The presence of oviparsal adhesions and thickened tortuous fallopian tubes is diagnostic of tuberculosis. An animal showing a chronic vaginal discharge must be examined for acid fast organisms, and you should not overrule the uh, tuberculosis as a cause of that infertility. Then leptospirosis. Leptospirosis is a zoonotic disease caused by parasitic spirochetes and characterized by fetal death, abortion, and birth of weak cows. Then it is either acute, which have increased body temperature, hemoglobinuria, icterus, abortion, and there are many serovars, the Leptospira pomona, Canicola, Ectrohemorrhagiae, Gripptyphosa, and then chronic can also chronic leptospirosis can also be seen, which includes abortion after 6 months, birth of weak cows, mastitis, blood tinged milk, especially because of Leptospira hardzo. Disease is most common in September and October. The transmission is through mucous membrane and abraded skin. The diagnosis is by detecting antibodies in fetal sera, urine sediments. Urine sediments are an important place wherein you can detect the leptospira, right? Then diagnosis, treatment, streptomycin, and a vaccine is available in some countries. Control, separate cattle from pigs, and control rodents, and especially pay attention to the drainage of water, because water accumulated here and there, um, logged in, then that can cause to leptospira infection. Then listeriosis is a gram-positive coccobacilli sporadic disease of ruminants characterized by encephalitis, abortion in last trimester, and neonatal septicemia, commonly occurring in winter. The transmission is by injection, and clinical signs include abortion, retained fetal membranes, endometritis, weight loss, transient infertility. Diagnosis is by fetal tissues, and treatment is tetracycline. Control involves remove the fetal tissues, avoid spoiled feed to prevent the spread of listeriosis. Then Salmonella abortions are sporadically caused by Salmonella dublin in cattle, Salmonella abortus ovis in sheep, and Salmonella enteriditis in pigs. However, the most important is Salmonella abortus equi, which causes abortions in mares. Right? Salmonella are present in the environment. Mares abort at 6 to 9 months and evidence a mild fever. Streptococcus zoopidomicus is another cause of abortion in poorly managed farms. Then we talk of the viral infections, include the bovine uh, infectious bovine rhinotracheitis, IBR, also called as rat nose, and infectious pustular vulvovaginitis caused by bovine herpes virus 1 and affects cattle and buffaloes. The respiratory form causes fever, congestion of nasal mucosa, nasal discharge, and ulcers of the nose and trachea. The conjunctival form affects all ages of animals and usually causes conjunctivitis. The abortive form uh, causes abortion in second half of gestation. There is red colored fluid in the body tissues of fetuses, and in encephalitic form affects young cows less than 6 months of age. Vulvovaginitis, also known as the coital vesicular exanthema, has a venereal transmission and causes balanoposthitis in bulls and vulvovaginitis in cows with whitish discharge for 2 to 3 weeks. The transmission contact with infected animals, diagnosis is identification from vulvar or vaginal scrapings, nasal conjunctival swabs. Samples should be refrigerated and sent on culture medium to the lab. Then treatment is palliative and vaccines. Infected animals are lifelong carriers. Heifers are immunized at 6 to 8 months. The immunity remains for 3 years, and live vaccines often produce latent infection. The control includes the destruction of aborted material and movement restriction. Modified live vaccines and killed vaccines are available for pregnant cattle. Then the bovine virus diarrhea, another important disease, uh, is caused by a toga virus having two types, type 1 and 2, causes gastrointestinal disease and diarrhea. The transmission is aerosol and contact with persistently infected animals. So this disease is very difficult to be controlled because of the presence of persistently infected animals. The bulls excrete virus in the semen following chronic infection. Cows born from infected animals are persistently infected. The clinical signs include pyrexia, diarrhea, ocular nasal discharge, ulcers, abortion at 2 to 4 months, fetal mummification. Mucosal type of disease shows that diarrhea and nasal discharge. The diagnosis is based on history of diarrhea, immunohistochemistry on fetal tissues, PCR, ELISA, and the control involves strict isolation and removal of persistently infected animals. Vaccination of replacement heifers with a modified live vaccine 2 months before their first breeding, and use of killed vaccines for other animals. Then chlamydiosis is the most common cause of abortion in sheep and goats and rarely in cattle, uh, caused by chlamydia psittaci is a gram negative intracellular organism that has both DNA and RNA. The transmission is pigeons and sparrows are reservoirs, and insects help in transmission. The organism persists in the feces of infected animals and is shed in uterine discharges for 3 weeks post abortion. The clinical signs include abortion during last month in primiparous eaves, slight febrile reaction, and blood tinged discharge. Placentitis is common. The diagnosis is from necrotic changes in the placenta, microscopic examination of Zaden stained smears from the placenta or the fetal tissue. Oral feeding of 400 to 500 milligram per animal per day of oxytetracycline for 2 weeks during an outbreak is suggested, or long acting tetracycline 6 to 8 weeks before the expected date of parturition. A vaccine is available for sheep and Zovac at some countries. It is given intramuscular or subcutaneous 8 weeks before breeding. The immunity lasts for 3 years. Chlamydia can infect human beings. Be careful. Then we talk of another protozoan disease, that is neosporosis. It's a protozoan infection. It has been increasingly being diagnosed at many places. It affects cattle and rarely sheep and goats, acquired by ingestion of feed contaminated pieces of dogs, and characterized by abortion between 4 to 6 months of gestation and birth of congenitally infected heifers. The clinical signs include abortion when animals are stressed. No other signs are visible. The diagnosis is through white foci in the muscles, heart, and liver of fetuses, and then one can use PCR, FAT, and ELISA for the diagnosis, for the confirmatory diagnosis. Then bovine, exotic bovine abortion is a cause of abortion and premature calving in cattle grazing in California, Nevada, and Oregon in USA. The disease is caused by an unnamed bacteria, a gram-negative bacteria of the Myxobacterium family. The transmission is by the ergacid tick, and clinical signs, the abortions are sporadic or outbreaks can occur in the last trimester, mostly in heifers. The diagnosis is by typical lesions on the fetus, include petechia and conjunctiva, tongue and oral mucosa. There is an enlargement of prescapular lymph nodes and a reduction of thymus with hemorrhages over it. So avoid the ticks for control of enzootic bovine abortion. A mycotic abortion, Aspergillus fumigatus, mucus species, or Candida species are the sporadic cause of abortion and infertility in cattle, mare, sheep, goat, and swine. Abortion are common in winter after a wet summer. Feeding of straw with fungi is the etiology. Rarely, inhalation of spores can cause the infection. Abortions occur during 6 to 8 months in cattle. Placentitis with coffee bean or cup-shaped cotyledons is characteristic lesion of mycotic abortions. The diagnosis is microscopic examination of placental or skin lesions after treatment with 10% potassium hydroxide reveal the fungi and their hyphae. Now we talk of the non-infectious causes of abortion, which include the ingestion of poisonous plants or administration of chemicals. Plants like loco beads, sweet clover, uh, pine needles, and administration of pharmaceuticals like nitrates, xylazine, anthelmintics, and of course the hydrocortisone, they can lead to abortions. Hormonal deficiencies like deficiency of progesterone, accidental administration of hormones like estrogen and corticosteroids can result, and even prostaglandin can result in abortions in cattle. Nutritional deficiencies like vitamin A, E, iodine, or selenium can rarely cause abortion in dairy cattle. Severe stress like heat, cold, transport, and trauma, and accidental AI of pregnant animals can cause abortion in a cow. Then, genetic defects of the embryo can also cause abortion in cattle. Now we talk of induced abortions or medical termination of pregnancy, what I have given the name VMTP. The abortions are sometimes desired to be induced in various farm animals. When they are induced nearer to parturition, they are called induced parturition. Now, what could be the reasons? Maybe diseases of pregnancy like pregnancy toxemia in sheep and goats, where continuance of the pregnancy would further worsen the condition of the patient. Systemic diseases like hemoglobinuria in buffaloes often indicate the induction of abortion to reduce the load of the ailing patient. Then abnormal pregnancies like hydrops, allantois, ventral hernia, rupture of the prepubic tendon, and fetal mummification also indicate an induced abortion. Or a rare could be termination of accidental small age pregnancies in heifers. So these could be the reasons why one may require the veterinary termination of pregnancies. For inducing abortion in cattle, prostaglandins are the most suitable drugs for inducing abortion. They are effective at all stages of gestation except during the 5 to 8 month period, when they should be combined with corticosteroids to terminate the pregnancy. Then estrogens and corticosteroid 25 milligram dexamethasone can be used to terminate bovine pregnancies. In sheep and goat, prostaglandins plus corticosteroids are effective, whereas in the sow, PG alone are effective in terminating pregnancies. Estrogens are ineffective in the sow as they are luteotropic. And in the Eve, prostaglandins are not effective after day 50 of alone, are not effective in terminating a pregnancy after day 50 in sheep. Because after day 50, the placenta produces sufficient progesterone to maintain the pregnancy. So I think this is all for the today's class, and we will have more classes on the sheep and goats infertility, the porcine infertility, the canine infertility, the equine infertility, and infertility in camels as well. Right? So stay tuned with us, and you will have the recordings of these classes. So don't worry about the PDF of these classes. Uh, okay, Nitin, don't worry about the PDF of these classes. So kindly share the videos and subscribe to my channel at YouTube, GNP Sir. If you like them, give your likes, give your comments, give your suggestions, and kindly do share and subscribe to my channel, GNP Sir. Uh, if you have any doubts about today's class, you can directly send me an email or call me at my cell number, and I will be very happy to help you out in any doubts that you have about today's class or even the previous live classes which we had earlier. So thank you very much. Uh, I find no questions here. So even if you have questions later, I will be happy to answer to any of your questions or queries. So and you can have the recordings of these lectures in our course. You can watch them for 1 year. Okay. So kindly do subscribe to GNP Sir at my YouTube. You can follow me at Instagram, uh, at LinkedIn, at Facebook, and at YouTube. See you. Bye bye. Have a nice time. Bye bye.